Hello, this is Dr. Greg from Wellington Hyperbarics looking at the topic today of Alzheimer's disease. Now in New Zealand there are 70,000 people currently affected by Alzheimer's dementia, and that's expected to grow by 100,000 to 170,000 by the year 2050. 4 out of 5 Kiwis know someone living with Alzheimer's, and this form of dementia impacts more women than men, around 30% higher. It is a progressive neurodegenerative disease, and it's more common in people ages 60 to 85, and this risk increases significantly as age increases. Memory impairment is typically the first symptom of Alzheimer's disease, while problems with thinking, decision-making, simple task execution, and motor movements increase as the disease progresses. Alzheimer's effectively reduces the working capacity of the brain to function fully and to store memories. Symptoms of Alzheimer's are caused by amyloid plaques and tau aggregates, which result in brain tissue inflammation, disrupted synapses, and nerve cell degeneration. Now, recent research suggests that decreased oxygen levels in the brain due to decreased blood flow causes amyloid plaque formation and the associated brain tissue damage. Current Alzheimer's treatments only target symptoms of Alzheimer's and include acetylcholinesterase inhibitors and NMDA antagonists. However, these classes of medications can have many adverse effects and do not treat the root cause of Alzheimer's. So how is the Alzheimer's brain assisted by HBOT? Well, HBOT increases cerebral blood flow and allows both blood and oxygen to reach parts of the brain that have not been sufficiently nourished, and that allows these areas to function better. And we do have research now that shows that HBOT can help sufferers to regain improved levels of cognitive performance, as well as dementia prevention. The benefits of HBOT in Alzheimer's relate to the fact that it directly affects the underlying causes. If you can significantly increase blood flow and oxygen concentration in the brain, as well as decreasing neuroinflammation, you can actually have effects on the pathology. The effects of HBOT on blood flow, oxygen levels, amyloid plaques, and inflammation in the brain suggest its potential as a low-risk treatment for Alzheimer's. The technology that we're talking about has been around since the 17th century, and it's been actively utilised in dive medicine in the 20th century, and it's used globally now to treat over 150 medical conditions. Treatment is provided in modern facilities using safe, well-established medical protocols, and this is usually done under the supervision of a doctor in a hard shell chamber. How does it work? Firstly, it saturates the body with oxygen. Now, this is a function of basic gas laws, particularly one of the laws called Henry's Law, which dictates how much of a gas is dissolved in a liquid, and it relates to the pressure above that liquid. The diagrams here are trying to represent the fact that we're not just talking about the body transporting oxygen with hemoglobin, which is the normal mechanism, but we're talking about actually oxygen being dissolved into blood plasma and then into the tissues from there. And in particular in the brain, we get the brain itself, we get the supporting structures, we get cerebrospinal fluid, all saturated with oxygen, which may previously have been inaccessible due to blood supply issues, previous damage. Additionally, HBOT decreases inflammation, and it does so by upregulating anti-inflammatory gene expression and decreasing the pro-inflammatory genes. HBOT also works by stimulating the formation of new blood vessels, and this is called angiogenesis. And what this does is it can bypass blockages, can result in injured tissues that had an inadequate blood supply, now being able to get oxygen and everything else that's carried by the blood. Hyperbaric oxygen also increases the number of circulating stem cells, and these are cells that are capable of becoming really any cell type in the body, and they're released by the bone marrow in hyperbaric conditions, and this creates the opportunity for the body to heal things that perhaps it wasn't able to heal on its own. So we know from brain imaging, particularly something called SPECT scanning, that you get measurable improvements in blood flow within the brain with hyperbaric oxygen treatment. And if in fact reduction in blood flow is the first pathology in Alzheimer's that then cascades all of the other things that we see downstream, then logically improving the blood flow will have an effect. This is a well-documented treatment internationally, sadly not available in New Zealand until now, and finally Kiwis have got the opportunity to see if this is an option for them. please feel free to review the extensive information that we've got on our website. And if you think that this is something that could be useful to you, get in touch. We can schedule a consult. We can have a chat. Thanks for your attention. Please visit hbot.kiwi.